Chemical weapons are devices that use chemicals to incapacitate, injure, or kill their intended victims. For weapon use, the chemicals are generally in a liquid or a gas form and are dispersed through the air. While not classified as chemical weapon agents, many industrial chemicals would be hazardous if released into the environment. Two qualities make chemical weapon agents particularly dangerous. First, with few exceptions, the effects of these agents occur within seconds to hours of exposure. In contrast, biological weapon agent effects typically occur days or even weeks after exposure. This difference makes the treatment of chemical agent exposures much more urgent. Second, chemical agents have a high risk of secondary contamination. This is because of persistence. Persistence is the ability of a chemical agent to maintain its toxic effects in the environment over time. If a highly persistent chemical agent is released, people entering the area hours or even days later may be contaminated and become ill. Chemical weapon agents are classified according to their effects on the human body. The major classes are nerve agents, such as sarin, blister agents, such as sulfur mustard, choking agents, such as phosgene, blood agents, such as hydrogen cyanide, and incapacitating agents, such as the hallucinogen BZ. Chemical weapon agents have a broad range of physical properties. These properties have practical importance to care providers because they impact such things as what kind of protective equipment is needed and how patients should be decontaminated.
Nerve agents is a class of chemical weapons agents that would be used to quickly kill a large number of people by interfering with their nervous system. There are 4 nerve agents: taboon, sarin, soman, and VX. They all have similar characteristics, that is that they are colorless when in liquid form. They are odorless when released as a volatile gas. They kill when used in very, very small quantities, and their action is very, very fast. The primary sign of exposure to a nerve agent is the inability to breathe. The victim's vision starts dimming because he suffers from something called miosis, which is the pupils become a pinprick size. The third is a dizziness starts setting in, disorientation, and then maybe twitching, excessive sweating. Eventually, you have full spasms, and then coma and death. And all this might happen within 2 or 3 minutes. Some of the nerve agents are very, very persistent, so healthcare providers, whether they're the ones who initially see the victims or the one who have to treat them in a hospital, have to worry about whether or not the victims are contaminated. Blister agents are a chemical weapons agent that, as the name suggests, blisters your skin. And it can, of course, have systemic effects also if it's inhaled. The 2 most common agents are mustard gas and lewisite. The first thing that first responders and hospital personnel would notice is that a bunch of people walk around with very, very inflamed eyes to the point where they couldn't see anymore. And this happened in World War I. You probably have all seen these documentary photos where you see these soldiers. They all have bandages over the eye, and one is leading another one in these long columns. Another sign would be that the skin would start, where the exposed skin would start turning red, like you had a slight sunburn or first-degree burn. The patient has been exposed to mustard maybe for half an hour or longer, starts developing very large watery blisters. If you let it go further than that, then it develops into a 3rd-degree burn where you're actually starting to affect the underlying tissues. If the patients have inhaled mustard into the system, that affects the tracheal and the esophageal lining and also the lungs. And you also get that kind of blistering effect inside. And that, of course, has very, very serious consequences. The blister agents have to be decontaminated. Otherwise, both the victim will suffer and the health provider will be at risk. Choking agents are chemical weapons agents that injure the lining of the larynx and the lungs. The way it works is that the membranes swell and the lungs, the injured lungs, start releasing fluid. And essentially you have the lungs filling up with fluid, preventing oxygen to get to the tissues, and the person drowns on their own internal fluids. There are two kinds of choking agents, chlorine and phosgene. Choking agents don't cause a big problem as far as decontamination because they're so volatile. Blood agents are chemical weapons agents that are used by the military or terrorists to asphyxiate the target population. There are two types of blood agents. One is the cyanic or the cyanide compounds, and the other ones are the arsenicals. The way that, for example, a terrorist would use it is probably try to disperse the agent as maybe from an industrial source within a closed environment. The treatment for a blood agent exposure should start immediately. Start administering 100% oxygen. Even though cyanide acts on the oxygen, it has been shown through practical experience that 100% oxygen is very helpful. And then, of course, get them to the hospital where the two-phase treatment begins. That will make a difference in the long run. Incapacitating agents are a class of chemical weapons agents that, as the name suggests, incapacitates the target population but does not kill them. There are three types of incapacitating agents. One is a tearing agent, the second is a vomiting agent, and the third is a psychedelic.
Many industries use hazardous chemicals, and there are many ways that industrial chemicals can become health threats, including refinery fires, chemical releases, and transportation accidents. These events can pose a serious risk both to workers and the surrounding community. In 1993, a chemical release into the air from a refinery in Richmond, California, resulted in more than 22,000 people seeking medical care. Although events like this have been unintentional, any of the thousands of chemical facilities throughout the state could be targeted by terrorists. Whether intentional or not, the release of hazardous industrial chemicals can cause respiratory illness, eye and skin irritation, gastrointestinal illness, and burns. High-level personal protective equipment, or PPE, is needed for full protection from chemical agent exposures. This is why hazmat personnel use specialized protective equipment that includes a full face shield and hood with an airtight seal, chemical-resistant suits, gloves, boots, and respiratory protection. PPE is rated from level A, the highest level of protection, to level D, the lowest level of protection. High-level PPE is expensive and requires extensive training to be used safely and effectively. The state of California's minimum recommendations for staff protection in chemical exposure settings is level D protection. This includes full face mask, water-repelling gown, gloves, hood or hair covering, and rubber boots. This level is adequate where no staff contact is anticipated and the chemical is known to be a low-risk contaminant. It is not adequate for high concentrations of the most toxic agents. It's important to understand that only the highest levels of PPE provide sufficient protection for the full range of chemical agent exposures. It is extremely important to decontaminate patients exposed to chemical agents as soon as possible. Rapid decontamination will minimize the severity of illness and reduce the risk of secondary contamination of others, including care providers. Optimally, decontamination should take place in the field as soon as patients have been removed from the site of exposure. Unfortunately, with a large-scale event, many patients may bypass pre-hospital care and arrive at hospitals still contaminated. All staff coming into contact with contaminated patients must have appropriate personal protective equipment. Patients who are unable to decontaminate themselves must be assisted. This places caregivers at higher risk for secondary contamination and may require higher level personal protective equipment. After decontamination, patient care can proceed safely.
The issue of antidotes does need some discussion. It's very important to remember that there are antidotes available only for a small subset of many different types of chemical agents a patient could be exposed to. In addition, some of these antidotes need to be administered literally within minutes of when a patient first becomes symptomatic, an example being atropine for a nerve agent exposure.
With few exceptions, the effects of chemical agents occur rapidly. Decontamination should begin immediately after victims are removed from the exposure area. Chemical weapon agents and industrial chemicals can persist in the environment and cause delayed effects. Appropriate use of personal protective equipment can decrease the risk of secondary contamination of medical care providers. Specific antidotes exist for some chemical weapon agents, but to be effective, treatment must begin soon after exposure.